Okay, we're just a couple minutes past the hour. I think it's good to go ahead and get started.
All right. Thank you, Catherine. I'm going to go ahead and introduce us here. We're really happy to be with you all today. Mary and I will be presenting on an incredibly important topic to your community, talking about compassion fatigue, how to build our resiliency, but really to think about our well-being, our overall whole health. So I'm just going to introduce myself, and then I'm going to invite my co-presenter, Mary, to introduce herself and kick us off. So I am Kavitha Reddy. I'm the Associate Director for Employee Whole Health, a physician by training, and incredibly excited, as I mentioned, to be here with you. So Mary, I'll turn it over to you.
Oh, thank you, Kavitha. My name is Mary Gallagher-Seaman. I'm an RN whole health consultant with the Office of Patient-Centered Care and Cultural Transformation. I do hold board certification in gerontology, nursing, end-of-life care, and as a nurse exec. And this is a topic very near and dear to our heart, especially as we begin to think about this during Nurses Week, Nurses Month actually, for the nurses in the room, as well as all of our colleagues, because compassion fatigue, resiliency building, and the use of employee whole health, we're going to be exploring to take a look at you and us together. So really important topic. So next slide, Kavitha. Just to give you an overview of some objectives, we're going to spend about 50 minutes together. We'll have some experiential time. We'll be experiencing mindfulness as well as a gratitude practice. And we're going to hear a wonderful field perspective that then a team in the Lebanon, Pennsylvania VA is using to address compassion fatigue themselves. And then we're going to be leaving you with some resources so that you'll be able to have some resources to use for your own self. So to get us started, let's take a second and really define and differentiate compassion fatigue and other terms that we've heard, perhaps such as burnout and others as we go. Next slide, please. Thank you. So when you compare compassion fatigue and burnout, compassion fatigue is, when you think about it, kind of the sticky residue that's left from interacting with traumatic situations. It can also have burnout components at the same time, but burnout is not about the trauma. It's more about the desensitization over time that happens, that kind of withdrawal from what gave us joy at one time, that sense of purpose in our work that moves backwards as we experience it now. The good news about compassion is that it really can, while it starts faster, it can also have more rapid recovery if it's managed and identified early. We're going to be talking about some opportunities to use employee whole health as modalities to do that. Next slide, please. I see that there's a lot of feedback. I'm not exactly sure where that's coming from. Is this any better?
That is a little better. Yeah, I was just coming in and out a little bit, but it's more clear now.
Sorry, we did a tech check and everything was fine during that. Of course, this is how it goes, right? So our time together today will be spent using compassion fatigue as our focus rather than burnout. So just to identify that. So when you think about kind of where this, we're just going to go to next slide, please. The commonalities between compassion fatigue and burnout, they really can present similarly. The physical exhaustion piece is huge, as well as the mental exhaustion, the isolation that can begin to come. And as you can start to infer, a lot of this could be exacerbated during the time of the pandemic, which we're experiencing and just coming out of. And ultimately, it's that really desensitization to the thing that drew us to this work in the first place, that lack of personal accomplishment as we follow. Next slide, please. There's a diagram actually, and you are probably familiar with it, the Figley diagram, that we're going to be taking a look at how this develops over time on the next slide. And it really is initial exposure to suffering, which is component of the work that you all do on a regular basis. And once that begins to happen, you have that empathetic response. And then as you begin to experience prolonged time with patients, with families that are going through this emotionally exhausting time during hospice and palliative care, it begins, as you can see, your empathetic response becomes more of a residual stress, and then ultimately it goes to fatigue. And that's really where it's the point where it's much harder at that point. If we intervene earlier to the left of the process with some of the modalities that we're going to share with you and certainly experience for yourself, you're able to correct that as it moves forward. Now, why does this become so important now? And I'll ask you for the next 2 slides. Thank you, Kavita. Certainly in the times that we're experiencing the pandemic, when you think about the social isolation that we've all experienced, the uncertainty, and the opportunity that we have to think about how we're going to come through the pandemic as a reconstructive phase. This diagram, okay, I'm going to stop here. I understand it's impossible. Could you maybe try? I'm really sorry.
No, that's okay. It's not your fault. There's a lot of environmental background. Our poor speaker is not currently in an office right now, and there's just a lot of background noise. It's okay. No problem. It happens. So we appreciate everyone for being patient with us.
Yeah, and I'll jump in. So
Much better. Yes.
Mary is phenomenal for all of you out there listening. She's doing this in transit, and so very committed to this work. So we'll check back in with her a little bit later in the presentation. So let me jump in and clarify, some of this diagram, because I think Mary was just talking about it. This is an interesting schematic because it allows us to look at our emotional reactions to disasters. And the reason I really like this reflection is much like the stages of death and dying, when we know we're going to feel certain emotions and reactions, we can then sit with that and know it's normal. And then we know that we can move through it. And in this situation, when we think about disasters, especially COVID, but also social situations that have been happening, unrest that's happened in a political scene, we've had a lot that's happened to us over the course of this year that's influenced maybe our staffing, morale, so many things within our environment. When we have those issues happen, it's important to note that this is normal. These are normal reactions and normal emotions, and that we will get through it. Another reflection I'd like us to think about is really this idea that last March, when COVID really hit, we had this sense of heroism coming together. We knew that this was something new. It was a challenge, almost an adrenaline reaction. But then there's no question, as we hit our second surge of COVID, the winter months hit, there was quite a bit of disillusionment, and many of us found ourselves feeling in these low points. But what I want us to think about is that it's critically important to collectively come forward and talk about our emotions around these issues, because we are experiencing it together and we will come through it together. And what you'll note is the reconstruction phase, likely where we're headed now, brings us to a different beginning, a different set of circumstances. And we'll need to sort of accept where we came from and commit to this future state. We will likely see some setbacks, but none will be hopefully as profound or as long as the original one in the disaster. So I think it's a nice framing, and I want to use this to give us an opportunity to share some of our own thoughts and reflections. So I'm going to pull up my chat box, and I'm hoping I can see your comments here. What are some of the concerns you're facing? Let's take that opportunity to type into the chat box. I'm going to give a pause here and let you guys do that. Safety, Emily is saying safety. Coping with change, new positions. I'm seeing depression, emotional fatigue. Will it happen again? That uncertainty, that volatility, we've really been living in those circumstances. Loneliness, how to keep the kids safe. Yeah, keep them coming, because what I want us to see is that we are having shared experiences here. We are all worried about very similar issues. And sometimes just the mere fact of having a space to say these out loud, to debrief what is no doubt a trauma, can help us move forward. It is a way for us to release some of that stress and tension. And so, as you guys are typing in, listen to each other as a community. You all do such similar work together across the country, and look at what you are all feeling right now. And these are normal. These are normal human emotions. And what we want to talk through today is some of the ways to process that kind of stress and tension. So as those are coming in, some of the things I hear from people as I do this work, maybe these will resonate with you: social isolation, fear of catching COVID, taking care of family, fatigue and exhaustion. I saw a lot of that in the comment boxes. Delivery of services, can I still deliver the kind of high quality care I want to deliver when I'm working from home or in a different office? Am I going to infect somebody else? And what about my own mental and physical well-being? How is that going during these times? And I think there's concerns about, when will kids get vaccine? How long will the vaccine last? And then if we make it specific about the work you all do, how has your role in palliative hospice care been dramatically changed? And it's pretty limiting to deal with the work you do, face-to-face interactions. Scott shared with us that you often have to put your masks on and you can't see each other's body language. And you came to know that that was something that really significantly impacted you. So I think these concerns are all very important. And I can't stress enough, the more you can create these environments, even if it's 20 minutes at the end of your rounds, to debrief and share what you're feeling, the better it is for our own mental health. So I want to take us through an exercise here. And the idea behind it, and I'm sure many of you do this with your veterans that you care for, or maybe with your teams, is to take us through an exercise that really reframes our thinking, and allows us a space to set our emotions in a positive light. And so I'm just going to invite you all, those who want to participate, if you can find a comfortable position. If you're sitting, just relax into your chair. If you want to walk for a bit while listening, that would be fine. Whatever you can do in the space you're at. And what I'd like us to do is just take a few deep breaths. The breathing, the intention of the breathing is to bring down the heart rate and breathing rate. And so what I'd like you to do is really lengthen the exhale. Count to 3 on your inhale, count to 5 on your exhale. I'm going to do the first one with you. So go ahead and take that deep breath in. 1, 2, 3, and then exhale. 1, 2, 3, 4, 5. And now I'll allow you to deepen your breath, same kind of inhale and exhale. And if you'd like, let your gaze fall to the floor. I'm going to close my eyes during this exercise, and feel free to do that if it feels comfortable. And just allow your breath to deepen even more. And with each inhale and exhale, just breathe out any tension or stress that you may be feeling. It could be in the neck and shoulders. Just allow them to gently fall down and back. Could be in your hands or your feet. Just allow your fingers and toes to relax. Settle into this space. And now I want you to imagine that you're walking or moving on a street. And you may see people that are moving to the left of you, people that are moving to the right of you. Maybe there's folks in front of you. Maybe there's some behind you. Just imagine these people are like thoughts in your mind. Thoughts of what's happened in the past. thoughts of what might be happening in the future. Just allow those thoughts to float in and out of your mind, just like people passing you on a sidewalk. Bringing your attention back to your breath each time. Just let those thoughts float in and out, no judgment. And now in this space where you're deepening your breath, I want you to think about 3 things that you are grateful for. Could be the people around you, your family, friends, loved ones, those that have come before, those that have passed on, memories, your pets, children, grandchildren. Could be your home, your community, your team, your peers. Could be your faith. Could be nature. So many different things you may be grateful for, but imagine the 3 that bring you joy and happiness. Knowing that you can bring your mind back to these things that matter most to you anytime. So truly the power of the mind. Breathing in those feelings of contentment or peace or happiness, whatever you may feel when you think of these things that you're grateful for. And breathing out any tension, stress. And if you find your mind wandering, just gently bring it back to those 3 things that matter most. And I'll just allow you a chance to breathe that in and out. And when you feel ready, go ahead and start to bring your attention back to the present state. Maybe you want to roll your neck, your shoulders back again, stretch, start to wiggle your toes and fingers, and gently open your eyes. Just come back to the screen. And now, as you guys are re-entering, I just invite you in the chat box to let me know what you are feeling now. What are some of the things just immediately came to your mind when I mentioned gratefulness? Who or what are you grateful for? And how do you feel? I once did this exercise and had somebody tell me they fell asleep, and I said, that might be what your body needs right now. You might need some sleep. That's okay. That's great. Joy, light, calm, relaxed. Yes, keep them coming. This is fantastic. This is really, I mean, you guys did this. You guys did it, and you were able to change your focus. I'm certain you do this with your veterans as well. I'm certain you find opportunities to connect them to what they are grateful for when they are going through such difficult times. And it's important to bring that back to you. And it doesn't take long, right? We only took a few minutes here to do this, and nobody needs to know you're doing it. So to me, I work in the ER. I do this often when I'm in front of my computer. Just stare a bit through that screen and just remind myself about what I'm grateful for to bring that tension level down. So let's talk about why this is important. I'll keep us moving as you guys are putting comments in. These are so awesome to read. We really want to take ourselves from what's the matter with us, what's happening to us, to a state where we're thinking about what matters most to us. So not what's the matter with us, but what matters to us. And the idea is that we can use this whole health framework and philosophy to really have this kind of self-awareness. And what I want to say about that is when you can bring yourself into the present moment, you have a much better chance of checking in with yourself around all these domains. What tends to happen when we're crazy busy and things are chaotic is that we don't check in on this circle, and we don't identify issues with our mental and physical well-being until there's actually symptoms. Much like disease management, we want to bring things further upstream, and we want to intervene with ourselves before we're starting to notice that our energy levels are draining, or our sleep is suffering, or our relationships are suffering. And I know COVID has really put a lot of us out of balance, and we're having to check back in on these areas and start to figure out resources to balance ourselves. So I really think of this as a tool for intervening before my stress and anxiety starts to create problems for me. And there's lots of ways to do it. When we think about the whole health system as a whole, there's a lot of resources out there, and we're going to share several with you, but resources are only powerful when you can actually connect them to what motivates you. The issue is that lots of times when we get a ton of resources thrown at us, it just feels overwhelming, and we can't possibly figure out where to start. When we think about compassion fatigue and burnout, this is very much the case. By the time we're already feeling those symptoms, we're already far enough down the spectrum of stress that it can feel overwhelming on how to change things. So I just want us to be considering that this is about small steps and about thinking about ways that you can bring this kind of peace of mind into your work day. And sometimes that means engaging with your fellow colleagues, peers, health coaches, to really talk about what matters most to you, just like we did at the beginning of this call. So you can use this personal health inventory, which walks around the circle, to remind yourself that you are at the center of this. Without your health and well-being, you can't care for your family, you can't care for your veterans, you can't care for each other. It is the most important part. Think about where you have strengths. Don't just dwell on what's not going well. I think as human beings, we tend to beat ourselves up a lot. And we do it with our care of veterans too. We always want to be the best and do best. Try to change that negative self-talk into positive talk. Where are you feeling strong? Every one of these areas interacts with each other. So you want to know how you're doing in each area, yes, but it's important that you pick what resonates with you. And I'd love to hear in the chat box where you guys feel you are feeling that you want to work on. I can tell you while you're typing that into the chat box, recharge always comes up for me. The bottom line is whatever you guys put in the chat box now, every one of these things connects. When I don't sleep well, how I choose my foods, how I move my body, how I interact with other people, all of that gets impacted. So it really doesn't matter where you choose to start. So I'm hearing sleeping well and eating well, recharge, food and drink. So the other thing I'll say about this before I move on is these are all windows into how your mental and physical health are doing. When you wake up in the middle of the night at 4 a.m. with a to-do list, that's a personal story for me that happens often. It's because I haven't had ways to release stress and anxiety throughout my day. It is trying to let me know that I need to do something to rebalance myself. And this ties into our ability to feel well at work and then show this kind of compassion to our veterans. And I am going to share a little bit more on drivers of compassion fatigue and burnout, but I really want to drive home that we do have power to change these areas of our life. And Emily, perfect, being able to advocate for myself. That's really the key. So think about how these things are interconnected and where you would like to be, and use it as a tool to really address, do I have accesses to the resources I need to be able to live the life that I want to live? And so let's talk a little bit about evidence, okay? I'm gonna switch gears, keep that in your mindset, this idea of self-care and the circle of health. But I think I'd be remiss if I didn't talk a bit about compassion fatigue and burnout and what the evidence says about it, right? Because there's a lot of things we can do, but as a system, we need to be a part of the changes and recommend changes that help our well-being as well. So I just want to point out, for those of you that are team leaders out there, supervisors, managers, there is tons of evidence to support investing in your well-being. It's why your leaders on the call today wanted this call as well. There's so much evidence behind investing in well-being and the connection to healthy employees delivering high quality, safe care. And when we see corporations invest in this, we see a reduction in costs related to turnover, sick leave, productivity. So these are really important to keep in mind as you create your strategies for supporting your employees. Make it a priority. It will definitely save you in the long run. So as we look at the evidence, this is a great article coming from the Ohio Policy Group, and it was a call to action around burnout. And what they said was, obviously we know there's physical and emotional consequences to burnout. You guys can read them at the top of the list, and some of you were mentioning some of these at the beginning of the call. Exhaustion, fatigue, and it can also lead to some of our behavior choices, right? And so they said, at the very base, we have to create a culture of well-being. This means our leaders need to understand that and promote a culture of well-being. And then we need to have policies and programs to support our employees. Always remembering that those that are in crisis or need, that should be destigmatized. We need mental health care more than ever right now. And seeking that out is a sign of strength, not a sign of weakness. And so we want to make that more accessible. But take a look at some of the tools there that can be helpful as we're all going through issues with burnout or compassion fatigue. We can look at mindfulness-based stress reduction, cognitive behavioral therapy, compassion and self-compassion practices, and creating communities where you can debrief what you're going through. Day in, day out, we go through micro traumas, whether it's our feeling that we can't deliver the type of care we want to because of bureaucracy, or it's because we're losing a patient who we feel is dying too young. There's a spectrum of things that we feel, and we have to have ways to constantly release that trauma so that we can be healthy. This is another article that I like, and I really encourage you guys to pull this one if you can. It's from the American Journal of Medicine, and it was a commentary on health and well-being using Maslow's hierarchy. The idea is that at the very base, we need to support our basic needs. Can we eat? Can we sleep? Do we have enough space for our day-to-day care? This was an issue during COVID. The Bronx VA actually did a lovely job of trying to bring water bottles and food to the inpatient nursing team, who was working double and triple shifts, sometimes sleeping at the facility. There's no question that we have to meet those basic needs first. Do I feel psychologically safe? Am I able to do my work? Do I have the tools I need to do the job? And then we really layer on top all these different categories that help us with our well-being. And so the nice thing is this article goes into targeted interventions that you can do at each level. And I find it to be very practical. And so if you guys are sitting out there thinking, this is really nice, but what do I do for my team? I think this is a great article. So just to highlight a couple. We have AES surveys every year, and that's great information that we get. However, what's happening month to month? We need a better way to understand what's happening with our teams. And so we really recommend doing frequent assessments of your teams and staff. And you can use 3 or 4 question surveys. We've got several recommendations in employee whole health, perceived stress, resiliency scores, to really understand if your staff are thriving or if they need additional assistance. Level 3, respect. Think about how you can bring these whole health messages into your existing trainings. Consolidate trainings so we don't feel bombarded with different messages all the time. Appreciation and connection. This is huge right now during COVID. Showing each other how you appreciate each other's work and time and facilitating community and connection is really what I've seen working for a lot of teams right now. So I highly encourage that. NCOD has the gratitude cards and VEO has thank you cards, lots of quick, easy ways to send messages to people. And then of course, thinking about your own personal and professional development to contribute more fully to the system. So I'll let you guys read these. The slides are definitely available to you after the presentation as well. Another thing I want to talk about, and I saw somebody mention this in the chat box, learning how to say no. Yes, I want to comment because I'm seeing a comment here about a good article. There's some bias towards privileges afforded physicians and doesn't apply as much to nurses. That article is about physician well-being, and I think it is important to think about determinants of health. What resources do you have access to? What is your work environment? And absolutely need to make sure that you're modifying that based on discipline. So really good comment. I also want to talk about, so somebody had mentioned in the chat box that saying no is really difficult. And I want to just talk about that for 1 second. So the Harvard Human Flourishing Program really feels strongly that we should be measuring flourishing, not necessarily burnout indices, because burnout is usually more of a state that's further along the spectrum of stress. And so the idea is you still are getting to all the areas of burnout, but you're asking them in a positive way. So they did a huge study at a manufacturing company looking at the cost of distraction. This is so interesting to me because what they found was that people who were able to job craft effectively actually had less distraction and more fulfillment in their work. And I highlighted their 3 main findings. So one of the ideas was that they were accepting and doing tasks that were of interest and challenging to them. And I know we're always talking about working to the height of our licenses. And I think that's part of the message. The other part of the message is asking ourselves, why do we say yes to things? Are we saying yes to projects, tasks, assignments because it matters to us and it's aligned with our values? Are we saying yes because we are looking for appreciation from external resources? What are the reasons we do it? We're all really high performing people and we don't want to disappoint people. And what often happens is we end up saying yes to things that we could say no to. Not always the case. Sometimes you need to when you're trying to professionally develop. Sometimes, Chelsea, you said you don't always feel like you have a choice. And I think those things are true. But I think it's also really important to sit and think about what are the consequences if I were to say no, and can I? The second thing is dialing up the social interactions, whether they're virtual or in person. And the third, again, goes back to what is my meaning and purpose, the center part of that circle. What are my values? What's important to me? And so just be thinking about that job crafting message. I think that's really important as you develop personally and professionally as an individual and with your teams. One final article that I'll share with you, again, yes, this is about physicians. However, in my interpretation of it, really speaks to a lot of the work you all do as palliative care and crosses disciplines. This is the idea that when we have these kinds of personalized encounters, we actually help our own well-being as well. And I think these personalized encounters get lost when our workload goes up due to staffing shortages or increased demands. And so I do just want to sit with this for a minute. I think the work you all do is so vitally important, and you create such trusted relationships with the people you care for at a really important time in their life. So just to reaffirm how you prepare with intention, how you listen, how you focus on what matters most to the person in front of you and connect with them and make shared goals around that, and how you are present for their emotional cues. These are things you guys are all probably saying, this is what we do, this is our profession, and it does make an impact on your well-being. So wherever you can, try to keep that in the forefront of your minds, and on busiest days, think about how you can still have that connection with the person in front of you. The evidence shows it really helps your own well-being. And as we look at AES survey scores and we look at this whole health type of care, which is what I just described, we do see that people who practice this type of care with their veterans, there's a correlation between that and how they feel about turnover and burnout. And we believe it's because they're getting to practice the kind of care they always wanted to. We've seen the same trend in 2020, and we see people who are applying whole health to themselves are experiencing less turnover and burnout as well. So the correlations are quite promising, and wanted to share that data with you. So let me check in here. Mary, I'm going to check in. I think you're still having some background noise, but wasn't sure. Just how's it going?
It seems to actually be a little bit worse, and it figures.
Okay, we'll keep.
I am so
Keep
sorry.
moving. No problem. No, don't be sorry at all. Actually, I see that time-wise, I'm going to go ahead and move and allow Scott to chime in now and share, because we really like to see, hear a real life example. And we can't hear you, Scott. No, still not hearing you. Let's just take a momentary pause and see if we can't get Scott online here. Scott, I wonder if you might need to drop off and sign back in, and maybe your mute unmute button will help. And meanwhile, I will keep us moving and come back to your scenario. How about that? And then we'll check in with Scott again. The information presented here, and we're going to hear a case example from Scott just as soon as he can get off mute, is highlighting mindfulness. So I'm going to spend a little time talking about mindfulness. So it is an evidence-based practice known to help compassion fatigue and really improve our resiliency. When people hear about mindfulness, sometimes I get reactions of, I got no time for that, or, oh, this is woo-woo. But really thinking about what we mean by that. This is the practice of really understanding how to be present, focused, present with our thoughts, with no judgment. And that no judgment piece, I think, is really important. I mentioned that we are very bad sometimes at our own negative self-talk. And when things don't go right, we beat ourselves up. We say, how could we do that? I can't believe I messed up. People aren't going to want me to do this again. We really beat ourselves up, worse than what would happen if we were talking to other colleagues. And what mindfulness does is help us choose how to react in a moment. When a bad situation happens, we have the ability to choose how we react. Do we want to be upset? Do we want to yell? Do we want to scream? Or do we want to say that that is maybe somebody else's anxiety issues present moment? The thing is that that takes practice to really bring yourself back to that present moment, kind of like we did earlier today. But studies show that when people invest in these kinds of trainings, they are able to control some of their emotional reactions to a very difficult system. And we've got systems with policies, documentation issues, team dynamic issues. All of these contribute to burnout. But how we react to those situations is in our control. And so that's really where mindfulness can be important. So let me check in with Scott and see if he's ready to share their example at their site.
I'll try again. Any luck on the audio now?
That's great.
Oh,
yes.
Great. Hey, thank you very much. This is clearly a bit personal in that, here being a national director for palliative and hospice care, we're supposed to have the perfect team, functioning and always high performing. And the reality is, I think the impact of largely COVID just kind of blindsided our team. And what we did really as a result of kind of interacting with both of you was to say, hold it, we need to dedicate some time to just our team and to building our team's health in ways that we could. And oh my gosh, this is, 2 or 3 months into this now. We dedicate a half hour each week. And I want to share that I think COVID has taken away so many of the rewarding aspects of hospice and palliative care, meeting and getting to know families by having them really be at the bedside 24/7 while we're delivering the care, having memorial services where you get to meet families, 6 months after the loss of a veteran, and they're smiling and they give you the big hug and they're just so appreciative. And I can go on, and then you put all of the stress with vaccination and exposures and isolations and oh my gosh. And so we started these half hour once a week meetings with the team. And I'm just going to share just a few quick ones. Our chaplain did something you talked about, Dr. Reddy, about, well, let's really put it on the table about what we're feeling over the last year, kind of things that we've experienced. and then added in the little challenge, you're only allowed to do it in 6 words or less. And we went around the room, and I just couldn't, I couldn't have imagined how impactful this past year has been on staff that I work with on a daily basis. And I learned things from that. And our psychologist brought in an article on, here's some concrete interventions like you're sharing today on trying to build the team and build back some of that resiliency within the team. And we did a TED talk on building trust. And I can go on, but I just wanted to let you know, I really think the more we involved frontline staff and other people in our team, the more powerful it became and started to spread throughout the team. I think we have a long ways to go to be better, but I would highly recommend the investment of some dedicated time to this area.
That's fantastic, Scott. Thank you so much for sharing. We're doing a pilot project with Thor Ringler and My Life, My Story, opening it to employees actually, and it's called What's on Your Mind. And we've been getting very similar feedback. I didn't know how much I needed this. I didn't know that I really needed to share this. I think we're conditioned often to do the work and keep moving, keep moving, keep moving. And again, we don't really have the time sometimes to look and reflect on how this has impacted us. So very powerful. Thank you for that. And I do see a question from the audience about chaplain service. Chaplain service is a critical piece of this model, the Spirit and Souls Circle. We collaborate so much with chaplain services. Chaplain Juliana Lesher, who's the National Director for Chaplain Services, was just on a recent VA Echo call that we do around whole health, talking about meaning and purpose and how critical that is to well-being. So I think fundamentally so important to include chaplains in our thinking around whole health. All right, so in these last 15 minutes, I am going to go through some resources, but keep in mind now when I talk about resources, it's all about connecting the resource with what matters to you. If recharge is what you want to work on, that's where you focus. If eating for your health and well-being is where you want to focus, go to those resources. This is really important that it's connected back to what matters to you. And then when you think about burnout too, and Scott did say this, where you can be involved with process improvement. I know not everybody wants to be, but where you can be, evidence does suggest that employee engagement and experience improves because you're a part of a solution and you don't feel as helpless. So where you see things that you can improve from a system standpoint, and I know not everybody has the luxury of being able to do it. This goes back to leadership, but I think your leadership really believes in this and employee well-being. So where you see that you can improve systems, that will also help burnout mitigation. So let's just talk about a few resources. We have something called Whole Health 102. It's actually a requirement for VHA modernization now that it's offered at a majority of facilities in every VISN. So you should be able to find an offering as these are dialing up. But it is a chance to walk around that circle of health and to do a deeper dive in each one of the domains. And it could be a really cool way to do this with your team because you learn a lot, as Scott said, about each other. And it's an opportunity to set your own goals around your well-being. If you feel like you've done that and you want to do a deeper dive, we also have a course called Taking Charge of My Life and Health. That's a multi-week course that can be facilitated at any facility. Our field consultants could help you if you're interested in thinking about how it could be implemented at your site. But think about health coaching as well. There's a lot of ways to do this. A lot of the federal insurance companies are offering this now. It can be through apps. It can be through whole health coaches on site. And professional coaching is also another option as you're developing your career. Here's just an example of Milwaukee VA. They offer a Taking Charge of My Life and Health group to all of their employees. Just an example of how they advertise. And here's an example from the Bronx. I mean, you guys remember me mentioning they were really trying to address the needs of their staff during COVID and the New York surges in COVID. And they did a pilot with our office offering health coaching and noticed a statistically significant reduction in stress and improvement in resiliency. And it was only 4 sessions. And so I think can be really impactful, again, to have space to talk about what matters, and the goals you want to work on. Be thinking about different resources you can use for your own well-being. Things like yoga, Tai Chi, meditation can be very impactful for stress and anxiety. And now with COVID, we have access to these in a virtual way. Tennessee Valley had an innovation where they created a Moodle platform, and they have on-demand content for all of these and more, full-length classes that you can do. And they have made this national now, so you can access the link outside of the VA system as well. Very similar to a lot of the on-demand platforms out there today. But I've also seen many VISNs creating shared calendars. And notice some of these mindful moment calls are just 10 minutes. Drop in if you can, listen, get back to your day. If something like that doesn't work for you, we do have a lot of recorded content that's short. This is Vantage Blog. There's more than 66 videos now for all sorts of things, from acupressure to stretching to breathing. Comes complete with videos as well, sometimes 10 minutes, sometimes 15 minutes, beautifully done. But if you don't have a whole bunch of time, the Organizational Health Council has worked with a lot of the VACO program offices to put together this one-stop shop for employee self-care resources. You can scan that QR code or click the link there, and it takes you to a site that I bookmark myself. And depending on what I need for the day, I can click on any one of these areas. If I need relaxation, that's what I can do, 3 minutes, 5 minutes. If I need to move the body, that's what I can do. Moments of reflection actually comes from our chaplain services office, and it's an invitation to be able to provide your own moment of reflection, and it would be uploaded as well. I'm just going to go back, Jamie, so you can scan that QR code. Whatever you choose to use, this is not meant to overwhelm you, but rather for you to find what works for you. This is all about individualization, what works for you, what works for your team. As of March, we actually have close to 60,000 page views here, so extremely popular. You might notice the link under Dr. Stone's emails if you take a look at those emails every week. Here's an example of how Huntington used the Microsoft Teams channels to create a water cooler environment. Just giving you guys some ideas. Their medical center director gets on this all the time and chimes in. But this is a huge opportunity to create team connection. We do it in our office, and we share photos of the environment or surroundings, and it's just something to make you smile and cheer each other on when you have busy, hard days. And then, of course, don't forget that there is an employee support toolkit that has a lot of these resources for you as a supervisor as well to support your teams, thinking about how you can help them be successful as well. So I want to leave you with one thing, is that if you're thinking, I do want to think and check in with myself about where I am physically, mentally, emotionally, spiritually, we do have an app now for the personal health inventory. It's Live Whole Health, and you can download it on your iPhones or Androids, and it'll walk you through doing this inventory for yourself. I think this is an important first step so that you can feel empowered around the kinds of things you want to do to support your health. And it takes you to all the resources on our internet site, which you can use outside the VA firewall as well. But just one final thing before I turn it back to Catherine and open it up to questions. We're not saying that burnout is only our compassion fatigue is only on us. Quite the opposite. It is a system issue. It is a team issue. It is an individual issue. What we want to shed light on is, while we're working on those system drivers, what can we do to support our well-being? Because we have to be here. We have to be here, and we want to deliver good care to our veterans, and we want to be happy and healthy. And so this was really meant to show you some of the empowering strategies. So hopefully that was helpful to you guys, and looking forward to hearing any feedback. So thank you. And Mary, thank you very much. Sorry about the feedback.
Well, thank you so much, Kavita. Yeah, if anyone has any questions, feel free to put them in the chat box. I've actually had a wave of requests asking for the slides, so I'm also going to attach that file in the chat box right now. And again, the recording and the slides will also be available on the We Honor Veterans website just as quickly as the website elves, which is myself, can get it up. So hopefully that'll be by the end of the week, but I am going to share it in the chat box right now. And yeah, feel free to post any thoughts, comments, reflections, questions. And if anything else pops into your mind or you want to provide some feedback or comments, feel free to reach out to myself or the We Honor Veterans team as well. And I'll put my email in here. But slides are coming your way right now.
I want to echo Mary's thoughts because I know it's hard for her to come off mute, but thank you for what you all do. I don't say that enough. I don't get to interact with your teams enough being in the ER, but I am constantly recommending families and veterans engage with palliative care and hospice care for that whole health type of support. So I just want to send my appreciation to all of you for how tough this has been during COVID and on. And if you have any questions, Mary and I would love to be able to answer those later as well if needed.
Okay, slides are loading, almost done. Yep, and that file just posted for anyone who wants to access those slides. And again, if you have any questions, you can reach out to veterans@nhpco.org.
Great, thank you.
Thanks.
Catherine, you want us to stay on still?
It's completely up to you. I'm seeing a lot of thank yous and praise.
Thank you for that.
I know this was extremely timely and a lot
so needed.
And staff, yeah, absolutely have been subtly and also not so subtly commenting that something like this would definitely be needed, particularly now. So I really appreciate all of you for presenting today and providing this to us. And I know that you would be welcome back anytime. So we hope to have another presentation with you all as well. Hopefully when
yes.
it's in transit and is able to be on solid, no technical gremlins in sight.
Words fail me today. Mary is amazing with her experientials and knowledge. And you'll be in for a treat when she does revisit.
Thank you. And Kavita, thank you so much for jumping in. And Scott, always enjoy. Thank you.
You guys, I can't believe with all the technology, you still made it like smooth. And so anyway, oh, we'll just hand it over to Kavita and call back in. So anyway, yeah, you do it very smoothly. I think grace was the major word for the day here. So very nice.
Oh, good.
We'll get feedback. If we hear anything, I guess we'll get the official feedback from EES, but Vision 23 was so appreciative. We knew that we had to do this on a bigger scale. I don't know how you guys operate, but this is one of those presentations where I'd like to get, kind of get on a call again, if you will, a national call, and that people could get to a chat box and say, okay, so what did you really do? Give us some feedback. What did you put into place, or what did you change? I don't know how you guys kind of operate. You do this presentation and then you kind of go off and probably do other things. And I'm just like, boy, how do you ever connect that circle of what was the real feedback loop? And I don't know how.
Yeah. Well, Mary, you might want to comment on field implementation team consultants. That is our way to connect with people in the field.
So thanks, Kavita. So each VISN in each facility has a field implementation team consultant whose job is to look at the whole health system implementation. And this is a piece of that. And so there's a connection that can be made back to the facility, as well as then further supporting whatever is being developed on a VISN level, because there's great VISN support for that as well. So whatever we can do to connect with those people would be great. Even I'm hearing the feedback, so I'm going to stop right there.
Yeah, and if sites are interested in that, feel free to email us and we can connect you to our SharePoint where it lists the consultants for each region and VISN.
No, that's really good to hear, because what I think our program office should do is, we meet with program managers, the regional program managers. I think we should give them that link, listing of here are the contact people in your VISN, and kind of try to make those connections between the teams at the facilities with those people to support it.
Yeah.
Anyway, so I thank you. I'll try to move that a little further down the road to help build those connections.
Yeah, that's great. And part of VHA modernization is also to have an employee whole health coordinator at every facility.
Mm-hmm.
So we're really dialing up the infrastructure in support of this. And I would really recommend they try to get in touch with that contact too, if it exists.
Okay.
Numbers are looking good that most sites are getting that person at their facility. So that's good.
I'll just say a very important time to be doing this.
Yeah, that's true.
Yeah, and just my sense of where my team, the team that I work with is, and other teams, we're doing consulting for these other community living centers. Oh my gosh, it was like opening the floodgates. And I don't know, Kavitha, if when you ask people to put into the chat box, what they're experiencing, it was, it was like 20 messages in less than a minute. And I just think that many of us may be getting vaccinated, and it may feel like there's light at the end of the tunnel, but boy, I feel like there's a lot of healing that still needs to go on. So anyway, just one.
From the very top, there's been concern about this sort of post-traumatic stress phenomenon we'll all feel with this. And it is going to take time. And how do we deal, so when you think about post-traumatic stress, what are the interventions for that? Really have to start to debrief that. Cognitive behavioral therapy, mindfulness-based, all those same kinds of therapies start to come up. And I think we need to do that with us as well.
Yeah, I definitely agree.
And these issues, Jamie's right, these issues were there before the pandemic. So I have two reflections for people who are still on. This is just shining a spotlight on what we knew existed before, right? We had issues before. And then the second thing is, as a healthcare system, this is a symptom of a healthcare system that needs to change to a more, a model that's more about personalized quality of care and, value-based care. And that's where we're shifting as a country. But I think burnout and fatigue and all of that is really a symptom of people. It's hard to function in the system.
Yeah, your comment there at the beginning about finding meaning and such. Oh my gosh, it just resonates so loudly with palliative care and what has been at the core of palliative care for so long.
That's right. That's right. And that's the interesting piece, right, Scott? So these are questions you likely ask your veterans all the time. And how often are you asking yourself? So,
get more done in the day, read more emails and all that kind of stuff. So,
Yep. So,
okay,
Catherine,
a lot of feedback regarding the slides. So again, the recording and the slides will be posted. I'm hoping tomorrow or the next day. People weren't able to access it in the chat box. So what I'm going to do is just download the registrant list from the webinar and send everyone the slides today. So that'll probably be the easiest way. And then again, you can go back and watch the recording, share it far and wide. That'll be available to everyone in a couple days. But yeah, the slides will be coming to your inboxes later this afternoon.
Great. Well, I'm going to go ahead and drop for the next call, but really loved being with your group. They were so engaged. It was awesome.
Oh, I'm so thankful
that you
were able to join. You are always welcome back and have a platform with us.
Thanks very much. Thanks much.
Everyone.
Bye, Catherine.
Bye.
Thank you.
Thanks, Ryan.